So welcome everybody. My name is Quinn. I'm GRIN Foundation's full-time scientific director, and I'm very excited to be partnering and co-hosting this webinar today with GRIN2B Foundation. And we're thrilled to be introducing GRIN Therapeutics for another webinar. And GRIN Therapeutics will be sharing updates on the Radiprodil trial for GRIN disorders, and you will have a chance to have your questions answered. So I'll hand it over to Liz from GRIN2B Foundation to introduce herself, and then GRIN Therapeutics will give their presentation, and then there will be a Q&A session at the end. So if you have any questions throughout, please feel free to drop them in the Q&A box, and we will get them answered for you. So Liz, if you want to introduce yourself.
Sure. Thank you, Quinn. Hello, everybody. Good morning or good afternoon, depending on where you're at. I am Liz Murphy-Ash, president of GRIN2B Foundation. And yes, we are also very excited to be co-hosting this webinar today with Cure GRIN and GRIN Therapeutics. And we're very excited to hear the latest updates on the Beeline trial. So, shall I pass it over to who's going first? Marjorie?
I can start us off.
Hillary? Okay,
Yeah,
thank you,
thanks
Hillary.
thanks so much, Liz and Quinn. We are always so thrilled to have the opportunity to be in front of the GRIN community and really deeply appreciative for the invite to speak today. As many of you may know, we gave a webinar late last year where we focused on a lot of detail about the history and of the science behind our study. And today we thought we would come to you with a little bit of a different take, which is to really talk about at an individual scale, what does participation in the Beeline trial look like for you and for your family? So we've asked some guests in today to speak about some processes that are in place for us, as well as the experience at the site. So we'll spend some time today hearing from Informed DNA, which is a genetic counseling service that we have set up in the US that can also help with referrals to the Beeline study. So we'll hear from Whitney to talk a little bit more about that and what that process looks like. Then after that, we're going to hear from one of the principal investigators in our study, Dr. Raj, who is at UCLA. And he's going to talk a little bit about what the experience is like at sites and what the kinds of things that he talks to his patients about when they're considering clinical trials and this trial in particular. And then Marjorie will come on and talk a little bit more about our program and provide some updates there about study sites and so on. I'd also encourage everyone who is on this webinar now to go back and watch the previous one, which is available on YouTube, if you're interested in more information in the background of the science and study design. So these two webinars sort of work in concert. Again, thank you so much for joining. And with that, I'm going to go ahead and pass it off to Whitney to get started.
Well, first, thank you so much for having me, and I'm very excited to be able to talk to you all and to help you understand a little bit more about the genetic counseling process setup for GRIN-related neurodevelopmental disorder. So, next slide. What we're going to talk about today are the telehealth genetic counseling services available to you, what that actually looks like. So, what is the referral and scheduling process? And then what will genetic counseling tell you about your child's variant? And then some of the potential clinical trial referrals that will lead into Dr. Raj talking some more. Next. So who is Informed DNA? We are the first telehealth genetic counseling company in the nation, and we've been at this for about 20 years. We have nationwide access to board certified and licensed genetic counselors. And we provide at-home convenient scheduling and appointment delivery through either your phone, mobile device, or computer, so you do not have to travel to have a genetic counseling appointment. We offer appointments daytime, nighttime, and weekends all across the nation, so time zone friendly appointments. And in addition to those counseling services, we partner with patient foundations and biopharma companies to identify and engage individuals that may be eligible for clinical research studies, including clinical trials. Next slide. So why is genetic counseling important after a diagnosis has been made? Genetic counseling is a caring and informative service that supports families in navigating complex genetic information. It's both educational and supportive, and it helps people understand and adapt to the medical, psychological, and family aspects of genetic contribution to a diagnosis. And for rare diseases where clinical trials may offer very important options to children and families, connecting you to those resources when eligible is really key. Next slide. So Inform DNA is partnering with GRIN Therapeutics to provide that compassionate support for patients with GRIN NDD and their families. And we aim to connect you with resources, genetic counseling, and certain available clinical research opportunities specifically for patients with GRIN NDD. And who's eligible for this genetic counseling? So anyone diagnosed with GRIN NDD is eligible, and it is at no cost to you. So how do you request a genetic counseling appointment? Next slide. So we're going to walk through this just one step at a time, and to really break down, it's a simple process. So the referral can be initiated either by you or by your healthcare provider, and there's a dedicated website that is linked here, and it'll be linked at the end in the QR code. But the referral is initiated from this website to request a genetic counseling appointment. And the key thing to note that I'll talk about again in a moment is the genetic test result report is required. Next slide. So here is the landing page, which is informdna.com/GRIN. And again, we'll have that at the end of my slides as well. But the landing page, really, there's a snippet on the screen, and you can request an appointment. And on that referral form, there's very basic information that we would ask you to fill out as part of that referral. So things like your child's name, the parent's name, date of birth, address, phone number, email address. And then if a language interpreter is needed, we provide telehealth services with interpreter services as needed. And then again, the key thing is that genetic test result report being uploaded. Why is that necessary? So that actually is part of the genetic counseling appointment that we'll talk about in a moment, where we will review the variant and determine eligibility for specific clinical studies. So allowing us to be able to have access to that is part of the process. And then the patients, go back one slide real quickly. So the last step is that there was a consent for Inform DNA to be able to contact you, and that is just the parent providing consent on behalf of the child. Next slide. Okay, so now that that referral has been initiated, what happens next? Our team of care coordinators will call you within 2 business days of receiving that referral to complete your registration and then offer to schedule a telehealth appointment with you. Next slide. And those appointments are offered in a 60-minute reserved slot. So 60 minutes dedicated time to you to answer questions and talk about the variant. And those again are offered daytime, nighttime, and evening and weekend appointments. Next slide. So what actually happens during this appointment? We really understand the challenges and uncertainties that come with a rare disease diagnosis. So our team of genetic counselors are here to guide you through the process, answer your questions, provide personalized support. And the session is dedicated time for you to understand the nuances of the genetic findings. So we review the GRIN variant identified in your child to determine eligibility for clinical trials. Next slide. So this is one of the busiest slides, but I think it helps once you start getting into the nuances of genetic results. They definitely get complex. So that is part of the service, is we really want to be able to offer helping you understand what does this result mean in a way that you understand it. So the genetic counselor will review your child's variant and indicate how the receptor is working. So I'll talk about that in a moment, and whether clinical research studies are available depending on that specific finding. So the first question when we're looking at test results is whether the variant identified on the test report is actually the root cause of the disease or the why of the symptoms. So is the genetic change identified disease causing, or is it still unknown and being studied? The next question is about the functionality of the variant identified. So how does this specific genetic change affect the NMDA receptor activity? So NMDA receptors are important for signaling in the brain, and they're associated with brain development, learning, and memory. So think of the NMDA receptor like a water faucet that controls water flow. Normal function of the receptor depends on whether water can flow properly from the faucet. And if something is faulty with the faucet, then the output could be changed. And so depending on that change, there's a different outcome. So here are the four examples I'm going to walk through real quickly with these images. If there is a variant that's called a gain of function, that means there's too much flow through the receptor. If there is a loss of function, that means it's too little flow. And then an indeterminate functionality means it's unclear the effect on the flow. If it's too much, too little, it's unclear. And then there are some variants that have not yet been characterized for us to know what is their actual function. Next slide. So how do we determine the function of your child's variant? So the genetic counseling appointment really details, and we'll go through, the genetic counselor will look on a GRIN portal to assess, has the variant actually been characterized? So a little bit of data digging, being able to determine based on a huge database of information, very well collated, and provides all the information on GRIN variants. What is the specific category your child's variant falls into? So one of these four categories that we just talked about, has the variant been characterized and its gain of function? There's that excessive water flow. Or has the variant been characterized and its loss of function or too little flow? Is it characterized but indeterminate? Or has it not been characterized yet and the function really is unknown? So based on that output, your child may be eligible for potential clinical trial studies. So if there is a gain of function variant, so that excessive water flow in GRIN, then patients under 18 years of age may qualify for the Beeline clinical trial, which is sponsored by GRIN Therapeutics, and what we're here to learn about today. So the individuals that we are assessing during the counseling appointment, we can help determine that eligibility based on the variant, and then connect you to a clinical trial site that would be able to fully assess for enrollment. There may be other clinical research studies, such as a natural history study or other non-gain of function studies available that we can also be able to connect you to if available. Next slide. So coming back to the appointment, so the counselor will go through what type of variant is it, what is the functionality, what happens next. Next slide. So we're going to come back to my diagram. So you had your initial appointment, And this slide is an example of what happens if the variant is determined to be that gain of function. So if that is the case, there would be a referral to the Beeline clinical trial sites, depending on where you are in the country and kind of the location. You also will receive a copy of a summary report from the genetic counselor. So you always get a copy back of what was discussed with you and the recommended next steps. Next slide. So if the variant is determined to be a loss of function or an indeterminate one, or the variant cannot be characterized, then there may be eligibility for other clinical research studies. And we will reach out to you when these studies become available. And if you're interested in them, then we'll connect you to the study team. And again, after the appointment, you receive a copy of a summary report that outlines what was discussed. Next slide. This one's a little busier, so I'll walk you through it. But again, focus where the arrow is during that initial appointment. If the variant is not yet characterized, there's a little bit more that has to happen. So the variant then can go through something called a characterization process, which means if we are not sure if it's gain of function, loss of function, or indeterminate, then we can contact the functional laboratory to perform further analysis of your child's variant. So it's important to note there's few labs that are capable of doing this, and it can take some time, but it is something that can be able to be done to be able to give you information about what is the function of that variant when it originally was not known. So once it is completed, then we'll reach out to schedule a follow-up appointment with your genetic counselor, so another telehealth appointment, to discuss that result update. So once there's additional information about the variant, then we can discuss, is there eligibility for the Beeline clinical trial if it's a gain of function variant, or is it for other future clinical trial studies? And again, you would receive a summary report with recommended steps at the end of that appointment. So here is that QR code and link again for the referral page. And I know we will have time at the end for questions. So drop them in the chat if you think of them right now. But thank you.
Thank you so much, Whitney. Please do drop your questions in the chat as they're arriving. We have team members on who can help answer them in real time. And I'm going to hand it over to Dr. Raj Rajaraman, who is going to talk a bit about the experience patients have at site.
Thank you, Hillary.
Thanks, Raj.
Appreciate everyone being here. Hi, everyone. My name is Raj Rajaraman. I'm a pediatric neurologist. I am an epileptologist, so I did a fellowship in epilepsy. My interest, my passion is rare genetic epilepsies. So I work at UCLA. I'm the director of the TSC Center of Excellence, and I see lots of patients with rare genetic epilepsies. And I do get approached frequently to be part of clinical trials. I was really excited for the Beeline trial. And I'll get into why I think this trial is exciting, how it could really help families, and we can go from there. Next slide, please. So why am I part of this trial is, you can do it the next slide. Thank you. So why, one is from a clinical standpoint, our GRIN NDD families can have a lot of seizures and have a lot of medical issues, and anything that we can try to figure out can help these families as a clinician and provider, I think is important. So the GRIN community has definitely let me know that patients have lots of seizures, can have behavioral issues, and there's a huge unmet need to really try to address these things. And that really got me interested in the GRIN community and trying to see if we have other options. The next thing is, from a research standpoint, I found that Radiprodil has a novel mechanism that can help treat the underlying root of GRIN2D. Now, of course, the Radiprodil has not been approved yet for the GRIN community. There's safety, efficacy, none of this has been established yet, and that's why we have to do the clinical trial. But I think theoretically the drug is exciting from a research standpoint because it really tries to treat the underlying cause of GRIN2D. So some seizure medications can feel like a Band-Aid, or where it works for broad categories of seizure types or seizure disorders. But I think this one is exciting because it really tries to work for GRIN2D. Next slide, please. So this Informed DNA, they did an awesome job explaining everything, so I don't really have to say too much, but I would say this is the NMDA receptor. It's this large receptor in the middle. And when you have a variant in GRIN disorder, it can affect how this receptor works. And if you see the little yellow square, that's Radiprodil, and that is the medication that's going to work on the NMDA receptor in the hopes of correcting it and trying to correct the underlying issue. So this drug works specifically at the receptor, theoretically, that is the issue with GRIN2D syndrome. So I think that's a pretty exciting, unique mechanism that is trying to treat the disorder. Next one, please. So I know the families, we have a huge unmet need. I think the mechanism is exciting, but also they've already done some initial phase 1B trial, the honeycomb trial, and it was exciting to me because we saw seizure reduction already in a small group of patients. So if you look on the bottom horizontal axis, you see the various umbrella groups, so GRIN1, GRIN2A, 2B, and then you will see that the dark boxes are the baseline seizures. So on the left, it goes from 0 to an 80. And you'll see that for each gene, you go from baseline, and then the slash lines, the smaller sections next to each solid bar, you see a reduction in seizures. And the individual change in countable motor seizure frequency was a reduction on average of 86%. So just in a small cohort, they were definitely able to see a really large seizure reduction. So that was exciting for me as an investigator, saying, hey, we've looked at a certain group of patients and we saw a definite seizure reduction. And that led GRIN Therapeutics to go to the next step. And another exciting part about this trial is that it's not just a seizure trial. Children and adults with GRIN2D can have behavioral issues too. And it's a wide spectrum, and we have to see where your family might be on the spectrum. But there was an irritability score called the ABC checklist. And if you see going from left to right, from maintenance, so starting the medication, to end of maintenance, the open label extension, meaning that everyone gets the drug, and as time goes on, the irritability scores went down. So in the 1B trial, the honeycomb trial, we saw seizure reduction, and then we also saw irritability score reductions during the trial. So I think that explains kind of why in the phase 3 study, we're looking at seizures as well as behavior and irritability. So I'm a primary investigator in the phase 3 B-line study. So it's double-blinded, which means that I won't know initially if you're receiving the medication. You won't know. It is randomized to placebo or drug. So in the first part, you either get drug or placebo. And then in the second part, everyone gets drug. So, and then we compare drug versus placebo to see the benefit, whether the drug is truly effective. And, Informed DNA, they went over what the kind of the flow pattern is. But if you have a variant in your GRIN mutation or GRIN variant, we try to see if you have a gain of function or a loss of function or indeterminate. And if we have a gain of function, you can fall into two groups. There is the seizure group and then also the behavioral group. So if your family member doesn't have enough seizures to be in the first seizure group, you can qualify for the behavior group. And then if you have a loss of function or is it indeterminate, or you just don't qualify for the cohort A or B in the gain of function, let's say you're above the age of 18, or you're on too many anti-seizure medications, if for some reason you don't qualify for the B-line trial, then you can be part of the natural history study. So it's a nice kind of umbrella natural history study so we can learn more for the GRIN community. And then if additional studies come out, then we can easily get you involved. So now we'll kind of go into how I meet the families and what's the process, and really try to make things as easy as possible for the family and to have a successful trial. So have a copy of your child's genetics report. So I would say if you don't have it already, ask your regular neurologist, can I have a copy of it? It might be in your kind of electronic medical record. If you're having difficulty finding it or the neurologist doesn't have a copy, then you can ask which lab did the testing, and maybe we could try to track it down that way. Once you have a copy of the genetics report, you can go to thebeelinestudy.com, or you can speak to the various advocacy groups who are giving this webinar to really try to get you connected. And then if you're, my patients, I already let them know about the Beeline study. But if you want to, you can always reach out independently to a site near you and say, hey, I'm interested in the Beeline study. What are the next steps? And we can tell you to go to informeddna.com/GRIN, and then we can make sure that the variant is either gain of function, loss of function, and figure out where your family falls in the process. So once you're connected to a trial site, we have the screening visit. So this is kind of really the big first step. Now, some of the families that I treat, some of this we already have, like the history and physical. But it's important to try to gather as much medical records as you can to kind of make sure that we have a thorough history, especially if this is the first time I'm meeting you. So we know, if you have prior surgeries, how many medications you're on currently, which ones you have tried and it didn't work, just so we have the information to make sure you qualify. We review the consent. That's pretty much the first thing we do, because we want to make sure if you're fully comfortable with the study. So we go over the study itself, risks, benefits, what is each part of the study. So there's a blood draw. What happens during the blood draw? What happens during the EKG? We talk about the questionnaires, what your responsibilities are as a family to be kind of part of the study. What are my responsibilities? And if everything looks good, then you sign the consent. And after the consent, we do vitals. We do a history and physical. We review the inclusion and exclusion criteria, which is really important because we can have the gain of function mutation or variant, or we can have different things, but we have to make sure that you family checks off all the boxes to be included in the study. And there's various things. So let's say we're on too many anti-seizure medications. There's a cutoff of 4 for this trial. Or if your child or your loved one is above the age of 18, you might not qualify for the Beeline study, but you can qualify for other things. So reviewing the inclusion and exclusion criteria is really important too. We obtain labs, make sure that our liver or kidneys, the values look good, and the EKG of the heart. And then we also discuss, if you're in the seizure group, how to track seizures on an app. So this is really important because we need a baseline seizure count. So before we even get involved in the study or get randomized to drug or placebo, we want to make sure the families know how to identify the seizure, or you let me know what the seizure looks like so I can say, okay, this is a tonic seizure. Is this a generalized tonic-clonic? Is this a drop seizure? Is it a focal seizure versus generalized? We have this discussion so we're all on the same page about what seizure type we have. Now, if you recently got an EEG or a recent doctor's note, and it might even just say, oh, we're having drop seizures or we're having tonic seizures. And that will let me know what are the typical seizure types your family's having, but we all just want to be on the same page. And then how to track the seizures. Do they occur in a cluster? Do they occur once a day, twice a day? And how to use the app. So that's really the screening visit to make sure we're all on the same page, whether you have any questions about the consent. We do labs, EKG. We take a thorough history, review the inclusion exclusion, and we learn how to track seizures on the app. And then after the screening visit, you come back for the randomization visit. So that would be at least a month probably afterwards. We come back, we say, oh, you have met the number of seizures to qualify. Your lab work looks very good. There's no concerns from GRIN Therapeutics. You're tracking well, and you're able to be randomized. And this is the exciting part where you either get randomized to drug or placebo. And again, I don't know if you're on drug or placebo. The family, we don't know, but we start tracking seizures like you have been, and we start doing in-person visits and phone visits, and that happens on a schedule, and we just continue our study. And then after part 1, you can choose to enroll in part 2, which is the open label extension. And that's where everyone gets the drug. So if you were on placebo, then you will get drug. If you're on drug, you will continue getting drug. We don't know if you're on, we won't tell anyone whether you're on drug or placebo. We won't know. Everything's still blinded, but you get transition in a blinded fashion from placebo to drug or from drug to drug, and you stay on drug. And then at that point, you receive the medication. At least I know and you know that we're now receiving medication, and the visits are every 3 months from that point on. So there is the screening visit and then the randomization visit. And at that point, we get to know everyone pretty well at this point. So I would be the primary investigator. Often I have a sub-investigator, and that's usually a physician, or it could be a nurse practitioner. And the sub-investigators help when I'm out of town or I'm having a clinic day. And we really try to be flexible to make sure that you can get in. So if I'm not available, we make sure there's a sub-investigator to help. But for the most part, I'm usually at all visits. Then we have our research coordinators. So this is at UCLA. In this picture, Angela is my research manager, and Natalie and Ruby are research coordinators. And they've had at least all of them have had at least 10 years of being a research coordinator manager and working with families and patients with genetic epilepsies. Our visits happen in our UCLA Clinical Trial and Research Center. So this is, for us, at least at UCLA, it's a site where clinical trials are being done. So it's a different site from where I see patients clinically. This is specifically for research. There's a playroom. There are separate rooms for every person where they have their research study conducted. And there you'll meet the CTRCs, what we call it, the research centers, nurses, phlebotomists. They will do the EKG, the vitals, the lab draws, if they have to administer medication. And sometimes you'll meet the same nurses and phlebotomists every visit. So that here at UCLA, we have a separate clinical trial and research center. So how often is in person? So every trial is different. For the Beeline study, there are 5 in-person visits for the seizure cohort. I'll talk about what we go over at these visits. The separate behavior cohort is 7 in-person visits. And the reason why it's a couple more additional in-person visits because that part of the study is longer. So we really want to see a difference if the drug is affecting behavior, reducing irritability and agitation. And that might take longer time than we might see a difference with the seizure cohort. So the behavior cohort has a little more in-person visits just because it's longer. Now the studies can range, the visits can range for a couple hours usually. They're fairly short. There's one longer visit where you have to stay pretty much the entire day, and that's where we measure PK values. And PK values is where your child receives the drug and you see how the drug affects the body. And we take blood draws throughout the visit. Now it's not necessarily multiple pokes or anything like that, but it's one longer visit throughout the day. So in terms of in-person, it is a commitment to be part of the clinical trial. There is a time investment. It's well worth it though. And I would say for this clinical trial compared to some other ones, the in-person visits are not as frequent as some other ones. So I think it is a time commitment, but it's definitely important. And it really makes the trial a success. What do we do kind of in between the clinical trial visits? Or during the visit, there's downtime. You can always get food at the cafeteria. This is our cafe across the street. UCLA is in Westwood, so it's a college town. There's restaurants and different things in the area. There's play areas. And we try to make things as comfortable as possible for the families. And so in terms of what might get my child excluded from the study. So these are just some of the exclusion criteria that I'll bring up now. There are other ones that are probably less likely to occur, but these are some things that we can address early on. So when you come to a pre-screening visit, we can say, these things are no longer an issue, or we can sort things out. So for the seizure cohort, being on more than 4 seizure medications, for this study, you have to be between 1 and 4 medications, and it has to be a stable regimen. So if we had a medication change a week prior to the screening visit, that would not allow someone to be randomized. So I would say, wait, a month and then come in for the screening. Try to keep things as stable as possible to the screening. And this now is just medication. So whether your child just got a VNS or had a change to the ketogenic diet, all these things kind of delay the possibility of being enrolled and randomized. So trying to keep things as stable as possible will be really important for the screening. Having other causes for seizures other than a GRIN mutation or GRIN variant. So some children, I've had this in other trials, where they might have had a brain injury plus a mutation, or they had 2 different mutations. They would have one mutation or both of them could have possibly caused disease. So that's the important part of why meeting with Informed DNA, getting the analysis kind of figured out, make sure that everything looks straightforward in terms of enrollment. So, but I would say the inclusion and exclusion, we can discuss this over the phone. We can go over this later. We can try to sort things out even before you come to the site. I think the first step is to get connected. We're talking about the seizure. Oh, sorry, one more thing. We're talking about the seizure cohort. But again, there's that large behavior symptom cohort. And some of the symptoms can be very mild. And, this is kind of a conversation you would have with the primary investigator, because we're trying to see where the symptoms are least moderate or severe, because we want to have room for change. So, we want to record, document change. So even though the symptoms might not be really that mild, if it's mild on the checklist or it's mild on the documentation, it might be difficult for the trial to see improvement. So it would be hard to see sometimes mild to very mild. But if you have moderate or severe symptoms, it'll be easier to see change. And that will be sorted out during the screening visit. But I would say just have that kind of in the back of your mind. If you're over the age of 18, we wouldn't be able to qualify for the Beeline study, but you would be able to qualify for the natural history study. And being connected to Informed DNA will let us, or let GRIN Therapeutics contact you about other opportunities. There are EEGs part of this trial. It can be, the great thing is you don't have to come into the hospital or the inpatient setting or to a clinic to get the EEG. It can be an at-home EEG, or if you want it to be done at a hotel, for whatever reasons, whatever's more comfortable, you can have the EEG done as comfortable as possible, trying to really reduce caregiver burden and make things easier for your child. Travel support is reimbursed and covered by GRIN Therapeutics for this trial. So travel, hotel, meals, anything that's mileage, all that is associated with site visits will be covered. And that includes the screening visit, which I think is really nice because, there is some disappointment that if you go for a screening visit and your child doesn't qualify for the study, additionally, you don't want to have a bill and you're not being part of the study, but GRIN Therapeutics will cover the screening visit. So I think getting screened, getting connected, getting seen is just really the really big first step. Okay, so what can families do to make trial a success? And a lot of this we kind of go over during the screening visit. So being able to identify seizures and track the seizures well. And I would say, if possible, even before you come for the screening visit, try to videotape your loved one's seizures so that I can take a look at the video and say, okay, this looks like a drop seizure. This looks like a tonic seizure. This looks like a certain type of seizure, and see if that correlates with your EEG report. Or if you haven't had an EEG in a while, I could take a look at the video and try to figure out exactly what we will call the seizure type, because the GRIN Therapeutics and investigators, we all have to be on the same page in terms of, and the families, of what the seizure is. Learning how to track the seizures. So most of the time, the clinical trials will like, at the end of the day, putting the seizures into the app. That way, we don't have kind of backlog in terms of seizures, just being comfortable at entering the data. Because really, these trials, the success really is based on your baseline seizure count and then being able to track seizures and see if there's a difference. That's really what it comes down to for the epilepsy cohort. Any kind of new things that happen during the trial. So as an investigator, I don't know yet, is there possible adverse effects that are related to this medication? And really the important part of this trial is safety. So if anything happens during the study, let's say you get started an antibiotic for an ear infection, or you have increased appetite, or let's say you have a fall and someone goes to ER because they break a bone, but some of this stuff might not be related to the medication, but we have to keep track of everything because we want to see if there's a signal for safety, and just by tracking everything, we can know. Now, some things you would think, oh, this is definitely not related. Let's say, the sibling is sick and they give the cold to your child who's in part of the trial. It's probably not related to the medication at all, but we track these things just to make sure that we're not missing anything. So tracking adverse effects, any kind of new diagnoses during this trial. So if, let's say, someone had, I don't know, a history of scoliosis, but it was a major issue, and then during the trial, the pediatrician or orthopedist said, hey, I think we should say you have scoliosis now. It might not be related to the medication, but this is something we tracked. So any kind of new medications, if you get started on antibiotics for ear infection, new diagnoses, adverse effects, any of these things, we keep track of. Notifying the study team if you're admitted to a hospital. So the sponsor GRIN Therapeutics and the the study team, it's important to know if someone gets admitted to the hospital because it could be a serious adverse event that gets priority in terms of concern. Also, we want to make sure if you have any issues with the study medication. So I've had families get admitted to the hospital and they forgot to bring the study medication, or they brought the study medication and the hospitalist team, they have questions about it. So they might ask, what is this? Stuff like that. And major thing is making sure that everyone is blinded. So we don't want some hospital teams trying to figure out, oh, this drug is, what is this? Any kind of things we want to make sure is by the protocol. So letting the study team know as soon as possible that you're admitted is important. New seizure types. This happens during trials where all of a sudden you see a different seizure type, letting me know and try to take a video or trying to figure out what's occurring. And then just being flexible. Some of these visits are a couple hours. There are usually a window in which these visits happen. They're not always, you have to come in on this day. There is flexibility. And there's flexibility on our end to see the families, but there time shift, there's traffic, there's always something. So just being flexible in terms of when to be seen. If you need letters for your work because you have to bring your child to a study, things like this we can address. And just if you have questions, be like, hey, this day is really not working, let us know as soon as possible. We can make things work. And then I think that's it for me. This is me and my research team. We're at a TSC walk, tuberous sclerosis complex walk. I do it every year. I'm really excited to try to help the GRIN community. I'm happy to see anyone clinically, even outside of this research study. We're really trying to find a medication treatment to address this unmet need for the community. So excited to be a part of this. Happy to answer any questions. Thank you.
Thank you so much, Dr. Raj. And I'm going to hand off to Marjorie.
Yeah. Thank you. So Marjorie Levy with GRIN Therapeutics. I want to first thank Whitney for walking us through the informed DNA process, and to Raj for really sharing what it's like to be part in a study, in particular at his site, but also details that are specific for our phase 3 study. So I want to also encourage, and I think Lauren put it in the chat, to go back and watch the YouTube recording of our previous webinar a few months back that goes into a little more details on our phase 3 study design and participation. But I know we're running short, but I just want to share a few brief closing thoughts. We're really excited to be here for the GRIN-NDD community, especially at a time where there are no treatments specifically approved for this disorder. And in the middle blue box, I'm just going to highlight what Raj did a nice job summarizing. We had preliminary efficacy and safety from a phase 1b study in GRIN-NDD. So this strong safety profile showed the investigational treatment was well tolerated and suggested a signal. In the next slide, this really made the regulators very excited, and we were granted both breakthrough and orphan drug. And just to let you know what that means, orphan drug is for rare diseases, and it really recognizes a significant unmet need. And breakthrough is granted when early clinical data that Raj presented suggests a treatment may offer meaningful improvement for serious or life-threatening conditions. And what does this mean for families and advocates? It means that the regulators see real promise in the early data and development so that the process can move through the review process more quickly. It doesn't mean it's approved already. This is why we're here to talk about the phase 3, but we do have this expedited connection with the FDA and regulators to move it through. So next slide. Today we focused on the steps required to determine potential eligibility. You have to have a GRIN-NDD diagnosis. Whitney did a nice job connecting through informed DNA and the services they provide in the US and the guidance and support to help facilitate through a screening visit at an appropriate site such as Raj's. And so all patients, I know this was a question that was in the Q&A, but I might as well talk about it here, that if you are in the trial, whether you are in the seizure or behavioral cohort, whether you're on study drug or placebo, at the end, you do have everybody will have the chance to be on study drug in an open label portion for either until you want to drop out until the study's closed or if it becomes approved and available. I do also want to remind you that the trial we're talking about is a placebo-controlled trial. That was discussed on the earlier webinar, but a placebo is a drug. It's blinded that Raj mentioned, but you're given a medicine that doesn't have any active drug, and it's a way to test if the active drug does have impact. So there is a 50-50 chance of being on placebo for the duration of the first part of the trial, and then you can move into active drug if you choose in the second part that's open label. So the next, again, just to review the key eligibility criteria, we know GRIN-NDD is not just a seizure disorder. In fact, many individuals do not present with identifiable seizures or with seizures. So we are enrolling patients that qualify with seizures that qualify or without seizures that will qualify for behavior. We're enrolling children and adolescents 1 month to 18 years. They have to have a known gain of function variant with GRIN1, 2A, 2B, 2D. That characterization can be handled through going through Whitney and can help, and we can work on that process. If you only have a GRIN-NDD, but you're not functionally characterized, we can help you with that as well. And again, 2 cohorts. Either you have a seizure cohort that qualifies 1 seizure per week for the baseline, or you have enough behavioral symptoms that qualify for the behavioral cohort. So depending on the presence or type, you may be enrolled in one of the 2. The next slide. So where are we today? This is a map of our current US study sites. And for those that were on our earlier webinar, you'll notice a few more green dots, the sites that are now active in recruiting in the US. We've opened additional sites since that webinar, and we will continue to do so. So we encourage you to look at clinicaltrials.gov for the most up-to-date information, or Inform DNA as well. We'll have those updated information for study sites as they become active to recruit and screen and recruit patients. It is a global study, so we do have sites outside the US that we're anticipating to be active within the next month. And sorry, in the last slide. So finally, here's some ways to get involved and stay connected. Inform DNA, websites there. We are very active with the advocacy organizations, GRIN, GRIN2B, for updates on research. We're incredibly grateful for this community, and we will have a clinicaltrials.gov site. We do have that, and a Beeline site as well. And if you have any questions, you can always contact patient advocacy at grintherapeutics.com. I just want to say to the GRIN advocates, families, and caregivers who joined, thank you. It's really your engagement, your questions on the call and throughout, and continued advocacy that really makes progress possible. And we're really deeply grateful for the partnership and the trust you place in us as we work together to find better options for the GRIN community. And really thank you again to Whitney and Raj for your presentation. I'm going to turn it back to Hillary.
Thank you so much, Marjorie. Marjorie has gotten so good at moving through those slides quickly. Thank you. I know we just have a couple minutes left. Marjorie and I can stay on longer if needed, but wanted to open up to questions. Quinn, Liz, I don't know if you're able to see them through the chat, if there's any that we haven't answered, or any that you've received otherwise.
Yeah, thank you so much. That was fantastic. I think they've all received answers in the chat, but maybe if anyone sees any that come up particularly often that are in the chat, maybe we can touch on those, unless there's any new ones that come in. So for example, someone is asking what the minimum frequency of seizure activity threshold is that would place a participant in the seizure cohort versus in the behavioral cohort. Maybe we can just address that out loud as well.
Marjorie, do you want to take that?
Do you want me to take it, or yeah, that's fine. So again, to to be considered for eligible for the seizure cohort, and again, this all the other criteria, age, etc., you have to have at least 4 countable motor seizures for the 4-week baseline, but it has to be 1 per week. So we're not just clustering. So you have to have at least 1 per week and at least 4 in the baseline that gets you in there. If you have a seizure that doesn't qualify in terms of number, you still may be able to be considered for the behavioral cohort if you have a score of at least 4 on the GRIN CGI scale. And we talked a little bit about that scale that we worked in partnership with the GRIN community on the webinar, so I encourage you to review. But it's a scale that assesses impact of improvement or worsening based on, domains that are really important for the GRIN NDD community. So you have to have at least 4 on that scale, and then we monitor change over the course of the trial with interventional therapy.
Great. And then maybe you could also quickly touch upon the open label extension and what you're specifically looking for in this portion.
Yeah, and I touched a little bit upon it. There's a part A and a part B, and we don't have the slide. The initial part is placebo controlled. So again, you have a 50% chance of being on either the drug or placebo. It's blinded, no one knows. But at the end of that maintenance, and the maintenance period is a little different for those of you that were on the webinar. Seizures is 12 and behavior is 24. It takes a little longer to see behavioral changes. At the end of the maintenance in either cohort, everybody has the chance to either stay on active drug if that's the arm they were on, or if they were in placebo and want to go on to the active drug, Radiprodil, they have the chance to do that. We are keeping that open label open as long as the trial is ongoing, or we halt the trial, or you want to leave, or it becomes commercially available. So it's not a 1 or 2 week, it will stay until it meets those criteria.
Right. And that'll help you kind of assess if the drug keeps working for a long time. Is that
certainly.
right?
So open label, there's reasons for open label. First of all, we know it's rare, there are limited options, and its ability for those that do see minimal or a lot or any type of improvement in a very difficult disorder to keep on that medication. But the second is we're always assessing safety as well and efficacy long-term for sure.
Great, thank you. I'm not seeing any new questions, and I realize we're at time here. So thank you all so much for being here today. This was
Hey, Quinn,
very
we do have one
informative.
more question in the Q&A. Oh,
Okay.
I guess got answered.
Okay, perfect.
Russell is so fast. So
Yes.
Russell behind the scenes, our medical director typing. So
thank you, Russell.
Sure, no problem. And if there are more, please let us know. We're happy to answer.
Yeah,
absolutely. Absolutely.
Thank
You can
you.
route questions through to us if they come in after, as always, after the webinar. And we just really are grateful for the opportunity to be in front of the GRIN community again. And thank you again to Dr. Raj and Whitney for spending time with us today to share their insights.
Thank you all so much.
Thank you, everyone.
everyone.
Thank you.
Thank
Bye.
you.
Bye.
Bye.